Well, 3,000 people, 9 public housing towers, 500 police standing guard. There is an unprecedented lockdown in Melbourne. For more on this, I'm now joined by Dr. Vyom Sharma, who has worked across several quarantine hotels. Doctor, great to have your company this morning. The tower lockdown, it's unprecedented. It's being called extreme. Given your experience, do you think this is necessary?
Look, we have seen such hard lockdowns with no exit or entry allowed in a couple of other places in the world. And when you look at international examples and how fast things can get out of hand, I think, unfortunately, to some extent, this is necessary. But the question is, the test is, can we do this with some sense of compassion towards people in these towers? We've got 23 cases so far, and that doesn't sound like a lot, but the key phrase there is so far. We've got 9,000 residents there. For all we know, there could be hundreds of people infected there. And if that infection transmits out into the community, we could have an unprecedented crisis in Victoria.
Doctor, it's really the issue of the close living quarters like these in these high-rise towers, isn't it? It's very hard to socially distance when the apartments are so close together, and there's often, and I'm generalising, but quite a lot of people living in a confined space.
No question. So this is high density living with lots of shared amenities where social distancing is very difficult. And we've seen similar situations unfold in Singapore where they'd kind of crushed the curve just like us, and yet we kind of look away from people with worse living conditions than what we might imagine everyone should have in the middle of a pandemic, and then things start to get out of hand very quickly. So it's about the number of their ability to transmit to others, and unless we get a good idea of how many people are infected there and actually provide hand sanitizer and social distancing within those towers, we're not going to be safe, and they are not going to be safe.
No, exactly. And the whole purpose of this in the next 5 days is to test everybody in those towers. Now, let's look at the numbers. Over the last week, they've increased every day. 108 new cases were identified yesterday in Victoria. How quickly do you think that can grow out of control?
Well, we only need to look back to last Sunday where we had 41 new cases, and the Sunday before that where we had roughly 20 new cases. So these numbers can get out of hand quickly, particularly because it's not just that number that's hit a triple figures, it's about the community transmission numbers. Every day we're finding 20, 25, 30 people who have contracted the infection from we don't know where. So the people they're infected by, we don't know if they're still spreading the infection. What we don't want to see is this doubling rate happen within a matter of days rather than a week or so. It could get out of hand quickly. The numbers are showing that the rate of the spread of the virus is increasing.
Vyom, what's your thoughts on shutting down just particular postcodes and suburbs rather than the entire CBD or the entire Greater Melbourne? Do you think that is a better avenue to go at this stage?
It's hard to say at this stage, but I can tell you right now, our public health officials would be asking themselves that question every night before they go to bed. We are seeing lots of cases in these hotspots, but you look at other places like Whittlesea and Wyndham, we're seeing increases there. And there will be that point where if we see enough increases outside those hotspots, it'll make no sense at all to go kind of zone by zone. And the big concern is that in those other areas outside the hotspots, we are not testing as intensely. So We've got to have a much lower threshold to bite the bullet and just get it done.
And you've got to ask your question from those hotspots, has the damage already been done, considering that the virus does take, a week or 10 days sometimes to present itself, and then there's people that are asymptomatic as well. We really appreciate your time this morning, Dr. Vyom Sharma. Thanks very much for your expertise. And if you are living in one of these towers, we would like to hear how you are going. Please contact us at today@9.com.au.